You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is how nerves are affected by the musculo-skeletal system. When people feel pain, the first reaction tends to be to reach for a tablet, but NSAIDS like Nurafen and Voltaren can become addictive. What if chronic inflammation keeps tormenting you? How can you get out of that revolving door? My special guest today is Dr. Jess Harvey, a registered osteopath, health coach and director of Head to Toe Health Service in Gold Coast and Brisbane in Australia. Jess is well qualified with 7 years of intensive tertiary study, including Master in Osteopathy. She has also completed personal training and life coach qualifications, plus study with ACNEM, the Demartini Institute, and the Barral Institute. So welcome aboard, Jess. Lovely to have you. I'd just like to ask, what is the common cause of chronic pain? It's not just when you stub your toe or you have an injury, but the pain keeps on and on and on, and the immune system can't get over the line, and it causes an inflammatory response, and it's almost like, the body's really struggling to do the right job, but something's holding it back from getting over the line. What causes issues like that?
Yeah, absolutely. That's a great question. So chronic pain is the third most costly ailment that we have here in Australia and across the world. So it's a really impactful issue for a lot of people. And, initially there's a trigger that, like stubbing our toe, there's a response from the body that happens. There's a whole signaling cascade. And our in the wisdom of our wonderful body, it goes to work at healing that. So what can happen is, if there isn't an immediate, if the body can't get that immediate healing response completed and go through to the full part of resolution of inflammation, then we end up in a cycle of chronic inflammation. And so one of the things about NSAIDs is that they actually block some of the signaling pathways. Yes, they reduce inflammation in the initial stage, but they don't allow the body to go fully into the resolution phase, which is where we actually clean up the debris from what's going on from the injury, and then we move that out, and the body can restore the health of the tissue and then ultimately restore homeostasis.
Yes, that's what we're aiming for, homeostasis and rebalancing. And so the body knows what to do. There is a program to get to that homeostasis, but something is like blocking the way. So in your profession, how do you diagnose, or how do you get to the root of the problem to work out what to do to get around that? And what kind of examples can you give? Give us a typical example.
Okay, so when I have a patient present and they are in chronic pain, so technically the term chronic means over 3 months, what I know is that there's most likely been a change to the nervous system that has created a pathway that's become almost a continuous hit, like it's just a continuous drumbeat that just keeps playing, a continuous song that just keeps playing in the head, that is laying down more of that pain pathway. So we have this great ability to learn and grow, and kids learn new things so quickly, and that's neuroplasticity. And our neuroplasticity can work for us, or in this case, it can work against us, where it's like if you're walking down a path in the bush and it's a really well-worn path, then if we want to walk down another path in the bush, we want to make that path, we need to go and we need to cut down some vegetation. We need to keep walking that path until it becomes more obvious, until it becomes cleared. And as we walk that path more, then the other path actually starts to grow.
Yeah.
Exactly, yes. So that's how I think of neuroplasticity in the body. So what we're looking for is, in clinic, we take a really thorough history of what's going on for the patient. So we're looking at all their lifestyle factors, we're looking at their diet, their sleep hygiene, their movement, their work, any things going on at home that could be stressing them, stress at work. We're looking at history as well, because there's all these adverse childhood events, ACEs, that can contribute to an increased stress response or a change in pain perception and pain signal. signaling from the brain. So we're looking at all this background so that we can pinpoint these specific areas that we can support the patient, not just in terms of a hands-on treatment in our musculoskeletal, reducing those drivers of that chronic inflammation that's keeping the process going for them. So that might mean cleaning up their sleep hygiene, supporting them with that. It might mean getting them drinking more water. It might mean changing their diet, taking out some
more magnesium
factors in their diet, and increasing some nutrients. So it's removing some things and it's increasing some things and adding some things in, which magnesium is one of our primary tools that we use in terms of getting nutrients into the body. So that can be orally or through the skin. And that makes a huge difference for patients.
Because it directly affects the nervous system, and the nerves run through the musculo-skeletal system. So if something's not right with the muscles or how the bones are connecting, or the joints or the ligaments, if something is strained or blocked or stuck, it then impacts on the nerves. And as you mentioned before, the signaling of pain to the brain. How do you work out in that skeletal system what you need to do to move, to release that block, that impediment that's sending signals to the brain via the nervous system? So
sure. So we have a two-pronged approach to that. Yeah. So we go and we look at the nervous system itself. Like, how healthy is the nervous system? Where is the patient sitting in terms of their balance between the sympathetic nervous system, which is the fight and flight, and the parasympathetic nervous system, which is the rest, relax, digest. So most of us are living in a sympathetic system, which is driving more pain, more inflammation. And
it's a terrible treadmill.
Absolutely, yes. And we're just trying to change that balance and bring down their sympathetics and bring up their parasympathetics, so they're more often in that relax, rest and recover phase, so their body can actually settle, and it's in a much better condition then to actually accept the changes that we're encouraging to move it towards more optimal biomechanics. So that's improved nerve supply, improved blood supply, improved drainage of the blood and the lymph, the fluid, the toxins out of the area as well. So we're looking through the nervous system in that respect. And so sometimes that requires some support with mindset as well, and reframing the stress response, that it's not always, stress is not always a bad thing. It can be damaging to the body, but it can also be supportive to the body and create resilience, and the body adapts to that stress to become stronger. So we're reframing mindset around that as well. In a mechanical sense and a physical sense, we're going in and doing a really thorough assessment of the body. We're doing a musculoskeletal screen. We're testing for the synchronicity of the diaphragms in the body. We're looking at things like skin tone and texture, muscle tone. It's hugely affected by magnesium deficiency, like we talked about. So we're looking at all those aspects, and we see joint restrictions and we see tight muscles as an indicator. That's a warning sign that something is not right. So I love to go to work to find why that's happening, because it's usually not the calf or the hamstring or the knee joint that's actually the problem. It's that's the result of tensions in the body that need to be released.
And it can be referred pain too, can't they?
Absolutely. It can be referred through the nervous system. It can be referred from a compensation that's happening. For example, if we've got someone with a chronic ankle injury, they may not be getting pain anymore, but that 10-year-old injury the body has got around that restriction by changing how the hip moves, for example. And then the pain might actually be felt in the hip.
Yeah, or the lower back.
Compensating, yep, or the lower back, upper back, neck, because it's compensating for what's going on in the foot and the ankle. Similar kind of thing in whiplash. We see patients who don't respond ideally, don't respond fully and resolve after a whiplash injury. Sometimes we need to go down and treat the lower back and the sacrum because of the tethering or the connection between the tissues in the head and the tissues in the sacrum. So what I love about osteopathy is we're always looking through the whole body to try and find what's going on so we can get full resolution for the patient, and reduce the recurrence of that issue.
I know someone who had a neck injury in a vehicle accident, and it then caused a chain reaction in their digestive system. So it must have somehow affected the vagus nerve, because then they became like a celiac and developed SIBO and colitis and all sorts of digestive issues afterwards. And it's complex for doctors these days, because I don't think they're really up on gut health that well, and how the nervous system affects the health of the gut. And that you mentioned stress before. Of course, that's an ongoing background stress then, isn't it? If you can't digest food properly, if the issue hasn't been corrected or fully resolved, then there's an ongoing problem which gets worse and worse if it's not tackled. Do you have conversations with your patients about diet and exercise and other lifestyle practices as well that can help them?
Yes, absolutely. That's a key part of what I do, what we do in the clinic is, there's so much importance. We can only do so much in 30 or 40 minutes in a session every week or month or whatever that might be appropriate to the patient. So it's really important for us to use that lifestyle coaching to support them to reduce those chronic low-grade inflammatory drivers. And that can be the fact that they've got leaky gut, for example, and there are food molecules that are not being broken up as small as they should be to get through the gut. They're getting through these increased size gaps through the gut, and then they're creating an immune response within the body as it goes to work to defend itself. So again, natural responses in the body that have gone a little bit awry because of our lifestyles. So yes, healing leaky gut is key. Digestion is so foundational to what we do. Sleep is really foundational. Movement is really important. And these are all ways to reduce that chronic inflammation. They're all ways to get us back into that parasympathetic mode.
Yeah, so what I've found from talking to various health practitioners in different fields is that it always comes down to toxins not being removed, like we're not getting rid of our waste products. They build up and cause acidity. The body then can't rebalance the pH to be in that slightly alkaline level, just over 7 in the cells, because that's what we need to produce good electrical energy. So then the metabolism slows down, and the immune system needs more energy, but it can't get more energy when metabolism is cut back. So that can then prolong that healing process. So you mentioned before how stress can be good in the sense that it makes us stronger, having those challenges along the way, just, pushing the boundaries out a little bit further, but then you need to rest and recover, because that time period of sleeping properly, putting the good nutrients in, allows the body to remove those waste products much more efficiently, to then rebuild and recover and make new cells and strengthen the muscles and strengthen the bones. All of that happens while we're sleeping, basically, doesn't it?
Absolutely, especially between that 10 p.m. and 2 a.m. So that's one of the main times that we encourage people to get to bed before that 10 o'clock point, before their cortisol tends to rise, and then that can upset their sleep. So circadian rhythms is really important for us to work with the body rather than against it, and embrace that. But yes, you mentioned stagnation. That's a huge component to disordered dis-ease, basically, that can then progress to dis-ease. So any stagnation of fluids can then cause inflammation, it can then cause pain, and it can affect the health of the tissues around it. And that can be muscle or joint tissue, but it can also be organ. We may have that stagnation around our organs. We've got a lot of flow that goes through the pelvis, the abdomen, and the chest, where our organs live. So mobilizing organs against the body wall, we can have organs that have restrictions in their movement that can then irritate the muscles near them. They can irritate nerves that pass them, or the nerve that is that is supplying them, and then that reflexes into other areas of the body. So definitely, you know, that's on the really local level, but then globally, in terms of the body and stagnation, we're looking at getting people moving more, because motion is motion.
The
So
vascular system needs, the circulation needs to move.
absolutely. Yeah, that's how we get oxygen, that's how we get nutrients, and that's how our tissues remain healthy. And like you said, that ideal acid base ratio or level is really important to conserve the health of our tissues as well.
But when people are experiencing pain or chronic pain, there's a resistance to exercise, isn't there? They tend to be more sedentary because they want to avoid the pain. So then it's a downward spiral. They're exacerbating that condition. So what do you recommend for people to work around that? How can they still get that blood circulation moving, even though they're dealing with a chronic pain situation that can take some time to resolve? You know, it happens incrementally, doesn't it?
Yes, absolutely. And it's so important to find the right type of movement, as opposed necessarily to exercise. You know, sometimes it's just about movement, and finding that right type of movement that fits into someone's lifestyle and that fits into someone's physiology. So, you know, we need to ideally be on the border of challenge, but not overdoing that. So enough stimulus to create a change, but not too much to take someone into more pain or more exhaustion or that sympathetic nervous system drive. So there's a few ways, you know, we can go everything from, you know, there's great accessibility now to things like restorative yoga, and those kind of things are wonderful. You know, we can even do them at home.
Yes, because that teaches you how to breathe properly too.
Absolutely. Yep. So breathing exercises are crucial to moderating the nervous system. We can use them to influence the vagus nerve as well, to help us with all those areas that the vagus nerve supports. So yeah, breathing exercises to bring the nervous system down, and the right type of movement. So one of the most basic things that we can do for those people who are at, you know, really bedridden, you know, any pain, any exercise causes them great pain and discomfort or might flare them up, is to, you could do this laying or sitting down. It's an isometric contraction. So you can go systemically through the body. You start at the feet and you contract the foot. So contract the bottom of the foot as hard as you possibly can, and then relax it. And then you contract the calf as hard as you can, and then relax it. And then you contract the hamstring, so the back of the thigh, and then relax it. So you go through step by step through the whole body. You do one leg, then the other leg, then you do the pelvis, and you work through the trunk. You do one arm, the other arm, then the neck and the face and head. And contracting those muscles actually gets more muscle growth, more muscle strength, and you're stimulating mitochondrial production and health as well. And the more mitochondria we have, the more energy we can produce, because they're those energy creating organelles within each cell. So it's a really nice way of maintaining muscle tone. I use that with patients who have maybe had a knee surgery, or they've got an ankle issue that means they can't actually weight bear at the moment. People who are so exhausted, they can barely get out of bed. You know, they're really great exercise. That's a really great exercise for those people. So it's almost a progression of the exercise progressive muscle relaxation, which is a relaxation exercise that often I recommend for people before they go to sleep.
Yep.
But we're contracting the muscles for longer, and you can increase that contraction time, and you can cycle through the body 2 or 3 times as the strength and resilience grows. And then we can start off with just some light movement. Walking is amazing. Going up and down hills, more interval kind of work, like going slower and going faster, and just gradually increasing the
Pushing the
load on the body.
boundaries. Yeah.
Yeah, pushing that boundary and increasing that resilience, but just, you know, always just monitoring. If there's a flare up, we just drop back a little bit, because we've got to moderate that process. And it's a learning process, because it's forever changing, right? The body's forever changing. We've got stressors coming in from everywhere. We live in a toxic soup, in our air, in our water. We've got, heavy stresses on us daily. We've got, food stress. There's so much going on. And so day to day, things are always shifting. That we've got the natural diurnal rhythms of the body as well.
Yep.
And it's about listening to the body and being able to recognize those signs. It's being present with the body for long enough to actually hear what it's saying and then act on that, because we've got to reconnect with our bodies and make them our best friends again.
That's it. And switch off the TV and go out and have a walk on the grass with your bare feet and be in nature, because it really helps with that disconnection and getting back to, yourself, being tuned into your own body, because it gives you messages. So if you learn, so those isometrics that you were describing, it can be a little bit like rubbing your hand and tap with the other one, tapping the top of your head. The coordination may take a bit of practice, because you've got to breathe into it at the same time. So you've got to focus on your breathing, and then you've got to focus on the muscle. You've got to get the two working together, because you can't stop breathing while you're focusing on the muscle, right?
That's right. Absolutely. And this is where mindfulness comes in. It's also a mindfulness exercise as well, because it's pretty hard to be ruminating over thoughts and stressing and worrying in the head when your thoughts are actually in your body. So it's a great way of reducing stress in that aspect as well. Whenever we can go from our head into our body, then we are helping our nervous system. We're helping reduce inflammation. We're helping chronic pain.
Yes. And it may help to look at your body as a vehicle, even like a separate entity that talks to you and tells you what's going on, a little bit like a biological AI. So it's not artificial. We could call it a BI, biological. Anyway, biological intelligence. Yeah, that works.
I like that.
We're like in kinesiology, when you ask the body, is it a yes or a no, to help you hone in on the problem. So some practitioners use that as an extra guideline because of the electrical system. The electrical system responds in a certain way. It's like an autonomic response. When you tap the knee, there's an automatic flinch, and you know what's connected to what, right? You know what works. So looking at the body as the answer, being in the body, and the body could communicate to you, also helps that self-help, doesn't it? That tuning in. And then you can, when you're with a practitioner, you can describe what's happening a little bit more accurately, a little bit more fully, a little bit more descriptively. And a lot's connected with your feelings and your state of mind. As you said, we're a whole entity, body, mind, soul. Everything is connected to something else and influenced. It's a bit like a ping pong ball bouncing back and forth, isn't it? But
Absolutely.
you don't want to be in a revolving door. You don't want to be in a place that you can't move forward, because you need to progress back to the balance beam.
Yes, absolutely. And how many times do we, as a society, dampen down those signals we're getting from our body? We might have a headache or feel tired. So grab a coffee or grab some high carb or sugary food.
Instead of drinking more
rather than
water with
actually
minerals.
Exactly. Maybe it's dehydration, maybe it's more rest, maybe it's a break of posture. It's those signals that we've become so used to dampening down.
Yeah,
And I think
ignoring.
that's what we're really missing in healthcare, and that's why we are having huge issues in mental health, in physical health. There's so much disease around, and we're just not listening to our body's signals. We've learnt to just squash them for convenience. And sometimes it's inconvenient to listen to those things. But there's other ways around it. And if we look after ourselves at a foundational level, then we're so much more equipped to handle those stressors and those issues going on.
Yes, the body has a messaging system, and pain is a big part of that. I liken it to the cells being like little babies, and when they need something and something's wrong, if they have a problem, they cry. And so pain is like the crying babies. So you have to work out what the hell's going on and fix it, right?
Absolutely. Pain is just a signal. It's just letting us know that we need to do something. And it could be as simple as, sitting over your computer and you get shoulder pain. That's just your body saying, I'm uncomfortable in this position.
Yep.
And the brain is interpreting those signals from that shoulder and then sending down a message to move. It was all right. Sending down a message to move, and if we ignore that, it'll just keep screaming and screaming and screaming. So we can go and take an NSAID, like a Nurafen or a Voltaren. We can block that inflammatory resolve.
Just muzzle it.
Phase, absolutely. And we actually end up in a worse position than we were before, rather than actually just listening to it, asking what our body needs, and actually giving it that.
Yep. That sounds like really good advice. But if people want to know more, how can they connect with you?
So the best way osteopathically is to look up Head to Toe Health. We're in Springwood and Coomera. So headtotoehealth.com.au, that's with a number 2. And there's also drjessharvey.com. That's our new website that we've just got up and running. So that links through to our osteopathy and also to some burnout offerings as well.
I noticed on your website you have really good little exercises on video as well people can do in their home. So they don't need to go out to the gym if that's inconvenient. They can just watch your videos because I think you do a really good job. I thoroughly encourage people to have a look.
Thank you. I appreciate that. Yeah, those resources are there. Originally, I popped them up for patients to, to refer directly to those. But they've become quite popular and they're quite well shared, which is amazing because, especially in the program section, there's really nice programs in terms of mobility and in terms of general strength, just to get people moving in a really gentle way. And then people can build on that from there. So, yeah, thank you.
That's really good. Well, thank you so much. I'm sure people will really enjoy this discussion and get motivated because that's the whole point. We're here to live a life fully. And that's all about taking care of our body vehicle and our mind, which is part of that, so that we can experience better things in life and have some fun, right?
Absolutely. Let's go from surviving to thriving.
Love it. I just love it. Thank you so much, Jess.
Thanks, Sandy. Appreciate your time.
Bye. I hope you liked this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and Magnesium special offers at elektramagnesium.com.au. Relax, recharge, and recover.